Oh, hey, so you caught me working on some of the exercises and things I teach patients who have acute lower back pain and may have sciatica. It's using the foam roller. You see, what I've found is that in some cases, there are some things you can do at home to wind up helping out your sciatica to get rid of it and to start to feel better. But I gotta let you know, if this winds up lasting longer than 3 days, you need to get some professional help, and a corrective chiropractor is the right one to go with it. Oh, by the way, I'm Dr. Gregg Gerstin with Align Wellness Center. I've been working with people over the last 17 years to help them achieve their best health. And sciatica is a major thing that winds up slowing people down from achieving that health. Now, sciatica is the inflammation of a nerve that goes down the back of your leg, but it can get mistaken for disc injuries and other lower back issues. So it's really important to know what you're working on. What I was doing here was working on our foam roller. And this is a great tool that you can use to target one of the muscles that can impinge the sciatic nerve. And that muscle is called the piriformis. It's a small muscle. Let me show you where it goes. From your hip to your sacrum. So in 33% of people, the sciatic nerve runs over it, through it, or underneath. And it really doesn't matter which one you are. If you've had problems with sciatica, it's important to make sure that that's not inflamed. And there's one on each side. It helps to keep your sacrum level so you can build a solid spine above it. What I was doing in this exercise was I was just really sitting on the foam roller on one side, on one cheek pretty much. And right in the middle is a small band, it's maybe the size of about an inch, that I was just focusing on rolling on. If you can handle this, it's a great tool to do to help stretch that muscle out and to relax it. You'll want to do it on both sides. If you can't handle it or it causes you pain or numbness going down your leg, stop. Get the right help. Figure out what's going on here, because when we leave this alone, it causes us to walk irregularly, work out irregularly, sit irregularly, and can cause a lot bigger problems than just a pain in your butt. Now, I'm Dr. Gregg Gerstin, and I've been helping people with problems like this for the last 17 years. If you like this tip, or you know someone who's had problems with sciatica, be sure to share it with them. If you liked it, give it a thumbs up. Each month, we look to connect with you and talk with you about health conditions that people go through, and give you some at-home solutions on what to do, and what a professional may look to do to help you. Once again, I'm Dr. Gregg Gerstin, and thank you for letting me be a part of your health.